Hello friends, good morning to all of you. In this series of my case presentations, I am going to narrate about a case of bronchial asthma of a lady having been treated in the year 1978 in the early days of my practice. The case is of a 47-year-old lady, then suffering from severe bouts of bronchial asthma, and I happened to see her suffering a lot and getting ameliorated or getting relief from some allopathic tablets and not injections actually. She used to take some tablets and get relief and used to suffer. I have seen the case. And on taking the complete case history, I have prepared 10 rubrics and I have done the repertorization properly. As the asthmatic bouts, dyspnea used to come in the nights, no doubt, disturbing the sleep, no doubt, till the morning also she used to suffer, and she desired open air. All these rubrics, as all of you know, all the doctors know, it has led to prescribe laxasis. She is in a climacteric period also, menses etc. have stopped, and having 4 children, and everything is going on well, but she is suffering with this thing. And in acute phases, actually I have given her Carbovis 200 in graduated doses. Graduated doses means, I told previously, the method is being followed in the 5th edition of Organon, and later the 50 millismol scale of potencies I wanted to use, and on the repertorization of 10 symptoms, laxasis has come into the picture, and laxasis 0/5 was given 3 pellets in 5 ml of distilled water. Actually we will be having 1 gram bottles, that is 5 ml, and 5 ml distilled water. I mixed these 3 pellets of laxasis 0/5 and 2 or 3 drops of rectified alcohol as the preservative. I asked her to take it as 3 doses per day, shaking well before using, shaking well before in a typical homeopathic suction. I advised them to take 2 drops from that one, from the ink filler, and in 2 spoons of water it has to be taken as a dose. Every time she has to stir or shake the bottle and continue the medicine. Like that, after getting relief, I asked her to stop it. And after 2 or 3 days, the situation has come into good control, and she started sleeping well, and her appetite, everything is good, and no more bouts of these things. As all of you know, this is basically an allergic type of tendency. It may recur at any time. I gave her assurance this will definitely work, and in different bouts, the regular bouts have expanded. Very much a gap has come between the bouts, and the medicine was used whenever it is necessary. And like that, from 0/5 to 0/10 we have gone there, and in those days the 50 millismol scales of potencies are not very regularly available at that time. We have purchased the first set of these medicines, 50 millismol scale of potencies, in Hyderabad when we went to have the registration of our diploma in 1976 September, and I have purchased 50 1 gram bottles of this 50 millismol scale of potencies, and I have started using this whenever they are necessary. Like this, the bouts when they have come down, we have stopped these medicines, and I gave some biochemic medicines. And the regular bouts of asthma have not come later, and I am talking about 1978, and later in 1996, after about 18 years, again the spell has come, and I used it once again, where we have stopped it in 0/10 laxis. Then from 0/10 I have started this medicine as previously, 3 pellets in 5 ml of distilled water, and after stirring thoroughly, taking 2 drops from it in 2 spoons of water, and like that she used to take, and she once again was comfortable. And I don't claim that the bronchial asthma has completely disappeared, but this since that is an allergic tendency or disease, it may be coming from the change of weather, change of dust, or food irregularities also may aggravate it. At that time of minor aggravation, she used to use 1 or 2 allopathic medicines. Otherwise, she was hale and healthy, and she continued her journey, and she lived up to 2022. She passed away at the age of 92 without any asthmatic bouts. The patient is none other than my own mother, since so I could observe everything very properly. In the last stages, I was suspecting she may get very big bouts, or get pulmonary problem or something like that, and I was prepared for it. But fortunately, she has not suffered that much, and she passed away simply in the sleep. At night, at about 11 o'clock, she slept, and in the morning, when we wanted to wake her up, she passed away. By the time, rigor mortis has also happened, which is understood that she passed away in the sleep itself about 2-3 hours earlier. Like that, we can utilize the 50 millismol scale of potencies, or LM scale of potencies. That is the refined system of potency using as per Dr. Hahnemann, who has concluded that this is the final answer for any types of diseases, and claimed in the 6th edition of Organon. And we started using the 50 millismol scale of potencies whenever it was completely indicated. And the caution is, whenever there is sufficient relief, we have to stop it. We should not continue the 50 ml scale of potencies mixed in distilled water, and continuing it is not necessary after the sufficient improvement. That is what I am telling to all my friends and students, and this is the story about 50 millismol scale of potencies and the asthmatic bouts coming to a end very early, and the patient survived for up to 92 years without any problem, without any worth mentioning problem. So with these few words, I would like to conclude this case narration. Please, as usual, please like, comment, and share these contents to other persons also who are interested in homeopathy. We will narrate some more cases in the future upcoming episodes. Thank you very much.